With this, I'd like to introduce Rick Little, who is the Director of Research and Analysis for the Utah Department of Workforce Services. He oversees labor market statistics, economic research, and reporting for unemployment insurance and public assistance programs, including TANF, food stamps, and Medicaid. Rick has more than 20 years' experience constructing computer models to evaluate programs and employee performance in federal and state government organizations. He holds a master's degree in human resources from Utah State University. As Rick's coming up, I'd like to thank the Department of Workforce Services, who initially were cautious. Let me say that. We're cautious about this approach. And I think as Rick and his team worked diligently to ferret out some of the data, they recognize that there is a difference between situational and intergenerational poverty, and that perhaps the approach that we've been taking in the past has not been exactly the right approach. And I'm pleased to introduce him and have him report on the wonderful report that he has provided to us today. I think you have at your tables. So thank you very much for your participation today, and Rick, we'll turn the time over to you.
Thank you very much. I appreciate the opportunity to address you today. I appreciate the invitation from Karen Crompton to address you this morning, and certainly the remarks by Senator Reed. This is a unique opportunity for us in state government to come and to share information and also to be somewhat of a charter member in establishing an innovative approach to looking at poverty. I have been with the agency, the Utah Department of Workforce Services, for something more now than 17 years, and much, I think, of what the Senator said with respect to how the programs tend to treat everyone the same way is accurate. And part of that is because I think the mindset is that we want people to be temporary in terms of their assistance. And so as the programs and services are administered, it tends to be that way. And so this has been very enlightening, I think, for myself and certainly for others in the agency to make a distinction between those that are situational and those that have chronic, multi-generational attachment to poverty and to the programs used to administer to that population. I wanted to begin by just showing a quick picture, and there's additional charts in the back of the program that shows the trend of poverty in the United States and in the state of Utah since the turn of the century. While it looks as a positive thing that Utah has a rate that is lower than the national average, it is still a rate that continues a somewhat upward trend overall. And I wondered, I questioned, I wonder how much this is associated with the economy and things that are going on. And there are certainly relationships in economic variables that contribute to or have a relationship with the number of people in poverty. But the two vertical blue squares that are on this chart show the most recent recessionary periods. And while we all acknowledge that we continue to feel the effects of the most recent recession, it technically ended in mid-09. And so we continue to feel the effects of that recession. Interestingly, though, during that period of time between 03 and 07, when the economy was very robust, I think by any measurement, the economy was very strong, perhaps as strong as it gets, we continued to see a slight increase in poverty until the economy finally reached that point where it began to draw people in poverty into the workforce. But that didn't last very long, unfortunately, because with the new recession came an even greater impact on those that live in poverty. And today we see Utah at 13.5%. By the way, that's a relatively new statistic. That one is only a couple of weeks old. When the report was assembled, I only had data up through 2010, and so the red numbers are the most current statistics that I had at the time that the report was compiled. Utah ranks 18th nationally with the 2010 data with respect to, we have the 18th lowest poverty rate. That said, it's still a lot of people affected. In looking at children, we see a very similar trend. And Utah ranks 12th nationally. And while things seem to have leveled out a little between 2010 and 2011, it's still 1 in every 6 children that are affected by poverty in the state of Utah, and certainly more than that nationally. So let's apply these numbers to Utah's population. Now again, this all relates back to 2010 because that's the data set that I had available to work with. And as a point in time, I selected data from the month of July 2010. At that time, the census estimate of the population was almost 2.8 million residents in the state of Utah and a 13.2% poverty rate. That results in approximately 365,000 individuals in the state of Utah living in poverty. Now, these are also broken out in 2 age groups, and these age groups are important in terms of the research, and I'll explain that in a moment. But for those ages 21 to 40, we see 842,000 residents, of which 111,000 approximately live in poverty, and then those children under the age of 18, 871,000 total residents in the state, of which 136,000 live in poverty. And that applies that 15.7 rate from the 2010 data. I wondered, what sort of reach does the Utah Department of Workforce Services have, point in time, in assisting those that meet the definition of poverty as used by the Census Bureau? And it turns out that while we have a variety of programs, the food stamp program is that program that probably most closely matches those poverty thresholds, because the net income of a particular household, given its family size, cannot exceed those same thresholds. And so using that as a comparison, in the month of July 2010, the Department of Workforce Services served just over 250,000 residents in the food stamp program. We know by definition that these are people that meet the poverty definition, and if we divide that by the approximate number of people in poverty at 365,000, we see that we have a reach, if you will, or a penetration into poverty of about 71%. When we look at the age breakouts, we see that there's a slightly fewer number of adults. I suspect, though I don't know, that much of that is because they may or may not have children in their home. Because when you look at the children, you see that the penetration is much greater. It seems that households with children are more likely to participate in these programs than people perhaps who do not have children. I'm going to come back to this chart in a moment, but I want to explore for a minute, why are we doing this? Well, as was mentioned earlier, Senate Bill 37 in the last legislative session, the Intergenerational Poverty Mitigation Act, requires the agency that I work for to establish and maintain a system to track intergenerational poverty-related data. And that's to do with these 3 things: to identify at-risk children and other groups, to identify trends, and then to assist caseworkers, social scientists, and government officials in the study and development of plans and programs. And why do we do that? Because we want to help individuals and families break the cycle of poverty. The Act establishes an annual report due not later than September 30th of each year. So we get to come back and measure these statistics on an annual basis, and that should be of great help to us in monitoring the results of our activities over time. This report will go to the governor, it will go to the Legislative Management Committee, and then it will go to the committee that Senator Reed mentioned, of which he is a member, the Economic Development and Workforce Services Interim Committee. This is the first report. So returning to the data here, the report asks us for the most current information that we have. And so we took data from state fiscal year 2012. That year ended June 30th of this year. And we expanded the look beyond just the food stamp population. And the reason for that is because many, many individuals move between food stamps and other means-based programs, including financial assistance, child care subsidies, and Medicaid. And in order for us to extract the most broad picture of what this population looks like, we extracted the data for all individuals that were in the public assistance database. In looking at the number of individuals served ages 21 to 40, we had 92,000 individuals, 215,000 children. We then applied the definition of intergenerational poverty, which I'm going to explain in just a moment, but it resulted in identifying 35,000, almost 36,000 adults served during state fiscal year 12 who themselves were children on assistance. And there were, now this, I'm sorry, there's a typo here. This says 50,079. That should be 51,079 children that pertain to or belong to those same households where those adults received services this year. That shows us then the resulting ratios of how many then of the public assistance population do they represent? 38, almost 39% for the adults, 23% for the children, about a third of all people living in poverty. And then even of the state population, it's a measurable number of people in the state population, 4.2% for the adults, 5.7%. I think if you actually rerun that number, the 51,000, it's closer to 5.9% for the children. So the methodology begins by looking at all of the adults that were served during the observation period. In this case, that's state fiscal year 2012. We then, even if they only received a single payment of assistance, a single benefit of medical care, we then took that individual and went back to their 21st birthday, no matter when that happened, and we wanted to see how many months of assistance has this individual received as an adult. If that number was more than 12 months, it doesn't have to be consecutive, just if there are 12 total months of assistance since their 21st birthday, then that person is no longer considered situational. They're not temporary. We then took that population and went back to 1989. Now, why 1989? Because that's as far back as I can go. If I could go back further, I would have done so, but that's as far back as the data goes. And in looking back to 1989, I can now observe how many of those individuals received assistance before their 18th birthday. And then likewise, we look to see how many months of assistance did they receive when they were children. And again, if that number was less than 12 months, not necessarily consecutive, but 12 total months, then they weren't situational as a child either. So those individuals that were shall we say, long-term or chronic as children and long-term or chronic as adults, that's our intergenerational population. So the methodology just looks at all those adults served, looks at their public assistance history, and then grabs those that are not situational. The generations might be described this way. I want to begin by looking at the second generation. The second generation are those adults that were served during state fiscal year 2012. They were children sometime between 1989 and the year 2008, before their 18th birthday. Their parents were the first generation. But this report does not look at their parents. This report looks at those individuals. So the first generation is defined as the parents of those that were in assistance in 2012. Those adults served in 2012, 2/3 of them have children. Those children are the third generation. And if those children, those teens, are pregnant or have children of their own, those babies, those infants, are the fourth generation. And that's how much information we can see in our 21-year observation period. Once we identified the population, the 35,778, and the corresponding 51,000 children in those households, we looked at these characteristics. So in addition to age and gender, we looked at the marital status of the adult. We looked to see how many children do they have. We looked to see where do they live. We looked at their education level to see whether they had any sort of post-secondary, whether they finished high school. We looked at their history of homelessness, whether they had felonies or misdemeanors. We looked to see if they had a disability. We looked to see whether they were proficient in their ability to speak English. We looked at their employment history, and then we looked at the different kinds of programs that they participated in as children and as adults. For the children, in addition to age and gender, we looked at their relationship to the adult. You'd think most often that they're sons and daughters, and you're right, most often they are. But quite often, they are grandchildren, or nieces or nephews, or they are stepchildren. They may be some other family member. We looked at their school status, if they were required to attend school, whether they were attending. We looked at whether they had a disability. We looked at teen pregnancy among this population. We looked also to see how many different intergenerational households do they reside in during a single year. And then likewise, we looked at their mix of programs and services. And so what did we find? Now, this is sort of a high-level examination, but I will refer to each of you. You should have received a copy of the report, and the details for each of those characteristics is identified in the report. But at a somewhat high level, these are the key findings, which is that, first, the more impoverished a person is during childhood, the more likely that person is to receive public assistance as an adult. Similar to that, the longer adults experienced poverty as children, the longer they are likely to be in poverty as adults. As I just stated, almost 36,000 children that received public assistance between 1989 and 2000 are now adults receiving public assistance. These second-generation adults are ages 21 to 40. And that explains why I don't look at people that are over 40, because I can't see their childhood experience in public assistance. They represent 1 in every 24 Utahns of the same age group. 2/3 of these adults have children of their own. These 51,000 children are the third generation receiving public assistance whose parents were also children receiving public assistance. And in looking at those teen girls receiving assistance, those ages 13 to 17, 1 in every 20 of those young ladies was expecting a baby in 2012. That's the fourth generation of public assistance that we can observe in the data. Just to contrast that, I did check to see what's the average pregnancy rate among teen girls in that age group, and this is more than twice the average. In Utah, more than 70% of all people living in poverty receive some kind of public assistance, including financial aid, child care subsidies, food stamps, and or Medicaid. Children in temporary assistance needy families. This is one of our financial aid programs, and it is the program that requires the most strict criteria for eligibility. That is, they are the poorest of those that we serve. They have the highest retention in public assistance when they're adults. And why do we know that? I went back to the data and I extracted every child that was in any of our public assistance programs in the years 1989, 1990, and 1991. I then looked to see how many of those children went on to receive assistance as adults. And what we see is that 36%, more than a third of all of those children in the TANF program went on to receive assistance as adults. This says AFDC because, as many of you know, the TANF program wasn't established until 1996. It was formerly known as Aid to Families with Dependent Children, and it had a set of different rules associated with it. But those AFDC children, more than 1/3 of the time, grew up to be public assistance recipients as adults. That's contrasted with the food stamp population at 29% and those in medical assistance households at 14%. The child care program wasn't evaluated because there was no data available to me prior to 1991. So what does this population look like? Well, not surprisingly, most intergenerational adults are unmarried females with children, and females are almost twice as likely as males to be intergenerational. And I've been asked several times, well, why is that? And it's most often because the mother is the custodial parent, and so she has the children in her custody, in her household. And as we saw, it's an observation that these households tend to participate in public assistance more than a solitary male, for example, who doesn't have children in the home. And about 70% of all of those intergenerational mothers have at least 2 children. 1/3 of intergenerational adults have less than a high school diploma. And among those that have a high school diploma, most of them have no post-secondary education or training. I was surprised to see that almost all of the intergenerational adults have some work history, but they don't make very much money. And I say that not just in comparison with the general population. They have very low incomes in comparison with other public assistance recipients. Their income is substantially lower than others that are not intergenerational but receive public assistance. And this is likely because they work in jobs that pay less, and also because they don't work as many hours. And then finally, every county, every community has intergenerational public assistance recipients. So this is not uniquely a Wasatch Front or a metropolitan problem. This is in every community. The first question I've been asked about this, why is race and ethnicity not in the report? Well, we're going to add race and ethnicity. At first glance, when I ran the numbers, the mix of race and ethnicity looked very much like it did for the rest of the public assistance population, and so I didn't include it. But the more I've read about intergenerational poverty, the more significant that variable appears to be in the research, and so in the future report, I will make sure that's part of the report, as will be characteristics around mental health, substance abuse. I'd also very much like to be able to see what other additional sources of data might be available for us to look at, because while the numbers I've presented seem somewhat comprehensive, we acknowledge that there are some intergenerational children out there that are not represented in these statistics. And a few of those that we can identify would, well, first be those that are part of a household where the adult recipient is over the age 40. I can't see that adult's childhood experience, and so I can't identify their children as intergenerational. Also, if someone has moved to Utah and they're receiving assistance in Utah now, I can't evaluate their childhood experience from another state. And so we know we have intergenerational children who are intergenerational, but we can't tell because they came from another state. Also, there is a number of individuals, for whatever reasons, decide that they're not going to utilize the public assistance programs that are available, and they receive help or assistance from other community-based organizations, including churches, shelters, food pantries, and local charities, among others. It would be great for us to work together to see if we can paint a fuller picture of what this population looks like. And then finally, we have a group of children that we can identify as intergenerational because their parent is absent. And the reason for their absenteeism, there are lots of reasons. One, they may not live in the home, and so I can't join the households together, or the absent parent lives in another state, or the absent parent is institutionalized or incarcerated, or in one way or another, not currently receiving public assistance in the state of Utah. And if I can't identify the parent as receiving assistance in Utah, I can't identify their child who may be receiving assistance from through a household member, a specified relative, or in foster care. I just can't identify that child as intergenerational. So we'd like very much to see if there are ways we can enhance the information resources available to us so that we can do a better job of tracking this population. There are some potential policy implications just in the data that we've seen, and I'm sure there'll be many others discussed today. I look forward to that. But as the Senator just said, the traditional services tends to treat everyone the same way. This data would allow us not just to identify individuals in the aggregate, but to identify them at the time they're receiving service, so that services might be tailored to improve outcomes for their children, outcomes around their education completion, high school, post-secondary, or some kind of vocational training, et cetera, to ensure that they have good and proper employment experiences. And then finally, to prevent unwanted pregnancy. These are just a few ideas, and I know that there are many more. I'd like to conclude with just these three thoughts. First, and I'm quoting the senator from an op-ed that was recently written. He says, more emphasis must be placed on children if America hopes to provide a pathway out of intergenerational poverty. Our economic policy priorities and resources must be focused on evidence-based solutions that are proven to work for children in poverty, including adult accountability for improving children's lives. My director, John Pierpont, said that we see this as a joint effort with the entire community, advocates and all stakeholders who want to be part of creating solutions. This is not just our charge. This is not just our responsibility. It's a shared responsibility. And then finally, and I really like this, and Joe Dem is here, but he and I were meeting with the media last week, and he said this, and I thought, this is very poignant, I think very applicable, is that society is defined in large part by how we treat those that are most vulnerable in our community. The closer we come to moving these numbers down, the closer we are to effecting real change. So I join my comment to Joe's and to the others that are here, that having information and data is one good first step for us to identify those that are vulnerable, and then to seek ways in which we might be able to serve them so that we interrupt this cycle of poverty. Thank you.